Welcome to Group 9's presentation on eye diseases. The eye allows us to receive visual stimulation from our surroundings. Obviously, sight is one of the 5 major senses, and so it really influences the way we move around in the world and our day-to-day life. Light passes through the cornea, the lens, and the retina, while the iris, ciliary bodies, and trabecular meshwork all work together to influence the image that our brain receives.
So Beattie's is caused by a mutation in the CYP4V2 gene. So what happens here is there's an enzyme in charge of a process called fatty acid oxidation, where lipids are broken down and converted into energy. So with this mutation, the enzyme is impaired, meaning that it can't do this. It's unknown how this all leads to the specific symptoms of Beattie's and why the severity differs so significantly among the people with the same gene mutation. It's inherited in an autosomal recessive pattern, meaning that the parents of someone who does have Beattie's, they each carry a copy of the mutated gene, but they usually don't show any signs or symptoms of the condition. So then you don't really know you have it until you start showing your signs and symptoms, which will usually show up in around teens or 20s. It begins with a loss of sharp vision, and they will also start to notice difficulty seeing in dim light. People with Beattie's often lose peripheral vision as well. There's also yellow, shiny deposits on the retina. And so then people with Beattie's will become legally blind by the time they're in their 40s or 50s.
Diagnosis of BCD is based on the presence of small yellow-white crystalline deposits in the retina. They may also be present in the cornea and other portions of the eye. Their presence in the retina is required for a diagnosis of BCD. There can be other diseases that lead to the crystalline deposits in the other portions of the eye, but for a diagnosis of BCD, they do have to be in the retina. Tools used include electroretinopathy to evaluate cone and rod dysfunction, a visual field test to test for vision deficits, and spectral domain OCT for identifying reflective dots. It can also be confirmed through molecular genetic testing that would identify the pathological variants of CYP4V2. In the EM on the right, these arrows, this one right here on the left, and there's one a little bit to the right of that, they point out two specific examples of the crystalline deposits that you can see on EM. There's currently no surgical or medical treatment specific to BCD. Yearly ophthalmologist appointments are used to monitor progression, with referrals to low vision specialists and state services for the blind if and when they are necessary.
A cataract is the clouding of the lens in your eye. The most common cause of cataracts is old age, because as you age, the lenses in your eyes deteriorate, causing them to lose transparency. Other causes are trauma to the eye, such as getting poked or scratched in the eye, radiation, such as UV rays from the sun, and congenital, which means you were born with it. Symptoms of cataracts include blurry vision, faded colors, double vision, and vision worsening at night. If you look at the image on the left, you can see a cataract caused by aging, also known as a nuclear sclerotic cataract. See right here, we have the lens, which is all cloudy. And over here, we have the cornea, and over here, we have the retina. The image on the right shows a cataract caused by trauma. As you can see, all this blue stuff in here is collagen. And these arrows right here are pointing out anterior fibrous metaplasia, which is caused by damage to the lens resulting in a cataract.
In order to diagnose cataracts, your doctor can conduct several tests. The most common tests are the visual acuity test, the slit lamp examination, or a retinal exam. In a visual acuity test, the doctor uses an eye chart like pictured in this image to the right to measure how well you can read a series of letters. The doctor will then use a chart or a viewing device to determine if your vision shows signs of impairment from cataracts. In a slit lamp examination, This allows your doctor to see the structures at the front of your eye under magnification. So as you can see in this image below, the doctor is using a microscope to project an intense line of light into the patient's eye, so it is able to illuminate the cornea, the iris, the lens, and the interior chamber of the eye. This allows him to detect any abnormalities in these structures of the patient. In a retinal exam, this allows the doctor to examine the retina of your eye more closely. This is done by using dilation drops. As you can see in these two images, a dilated pupil allows a lot more area to be seen than an undilated pupil. So once the pupils are dilated, the doctor can then view the retina more clearly and look for signs of cataracts in the lens. After the cataracts diagnosis has been confirmed, the doctor will then follow up with a treatment plan for the patient. The most two common treatment plans for cataracts is prescription eyeglass-wear change or lens replacement surgery. If the cataract is not too severe, a simple change in prescription glassware can clear the patient's vision. But once it begins to affect their quality of life and their ability to perform everyday tasks, surgery is then suggested. In the lens replacement surgery, the doctor will remove the clouded lens that is causing the impairment and replace it with an artificial intraocular lens. So as you can see in this image below, this is an intraocular lens that has replaced the clouded lens, and it can remain in the patient's eye permanently, and it does not need to be removed or replaced. Now we're going to go over some exam questions. So in the first question, it asks, which image and description correctly matches the diagnosis of cataracts? So in A, the term is visual acuity test, and the description is the pupil is dilated to allow the doctor to have a better view of the retina. This does not match because, like stated earlier in the PowerPoint, a visual acuity test uses an eye chart to measure how well you can read a series of letters. If you look over to the picture of A, this also does not match. This is depicting a retinal exam, not a visual acuity test, so this makes A incorrect. B, the term is a retinal exam, and the description is the doctor uses an eye chart to measure how well you can read a series of letters. This does not match either. And if you look over to the picture B, this depicts a visual acuity test and not a retinal exam. So A and B are actually flip-flopped, making those both incorrect. So if you look at C, the term is a slit lamp examination, and the description is this allows the doctor to view the structures of the eye under magnification. So if we look over to the picture, this is a depiction of a slit lamp examination because the microscope is shining that intense light into the patient's eye in order to magnify it. So C, in this question, C would be the correct answer.
Is which functions correctly match the layer of the eye labeled? If we could pause it to give everybody a chance to attempt it, and then I will explain the correct answer. So the first thing we want to do is identify which layers that these are. A is going to be the aqueous humor, B would be the fovea, and C would be the retina. So the aqueous humor, it's fluid that nourishes the cornea lens and provides nutrients to the eye, such as vitamin C, and it provides the ability to expand the cornea to protect from things such as dust. So that would be correct for A. Now let's check B, the fovea. The fovea is a part of the retina, and it's really to provide sharp vision, like for things such as reading or driving. It contains cones that take the light and send signals to the nerve impulses which travel to the brain. So then C, which is going to be the retina, it could easily be mixed up with the fovea just because the fovea is a part of the retina, but the function of the retina is to provide you to be able to see overall, versus where the fovea focuses on sharp vision for specific things. So then here your answer will be A, because the ability to see is too broad for the fovea, and then provide sharp vision wouldn't be correct for C because that's actually for the fovea.
Which of the following cannot cause a cataract to occur? A, UV rays from the sun. B, wearing glasses. C, getting poked in the eye. D, A and B. Or E, A, B, and C? The correct answer here is B, as wearing glasses cannot cause a cataract.